I'm super excited to be here today with Dr. Roohi Jeelani. And I never read, but I'm going to read. Double board certified reproductive endocrinologist and infertility specialist. You also have a special interest in oncofertility, toxins' impact on reproductive function, chemotherapy, and oocyte cryopreservation. Those things are of particular interest to me for obvious reasons. But let's just start with hello and thank you for being here. I know we rescheduled this a few times, so this is really lovely of you. Whenever I interview doctors, I'm very mindful of time. You see patients, you are in your office, so I'm not going to steal your time from someone who made an appointment to see you. But I really am excited to talk to you. And I'm excited for people who listen to learn more about you as a person and your story and your journey. And then, of course, what you do and how you've become such an expert in this field. So will you just start with, I guess, your journey and how you got to this place through your personal, as much as you're willing to share your personal journey, and then also your professional journey through your medicine, your medical training and all of that, and how you got to where you are.
Of course. That's a long story, but I am happy to share all of it. My mom and dad separated or got divorced when I was a teenager when I was 11, 12. My mom moved back home to Chicago where the rest of her family was. And she's one of 10. Huge family with lots of opinions. We're Indian, so everyone has an opinion. When we moved here, she realized that, all of her other nieces were getting their period. She goes, oh my God, my daughter's not getting her period. What's going on? So she would take me to a pediatrician, then she would take me to a primary, and everyone was like, it will come, she's fine. And then somebody's like, oh, she's anorexic, so she started feeding me. So remember, she would drop me off to school and she would stop off at Burger King, and every morning she'd buy me a Dr. Pepper, a Snickers bar, and a croissant egg sandwich. That was like my breakfast.
That's disgusting.
That is disgusting.
I'd kill my kids if they wanted that.
And every morning she's like, okay, I'm going to fatten her up, and then she's going to get a period.
And you were 12 at this point?
I was 13.
Which is still very young.
I know.
Okay, go ahead. Yeah.
She's still so I think now if I could reflect back, I think she thought she did something wrong by leaving my dad, and everyone was super against it. Like, that is not a norm for Indian women to, you just tough it through. Mm-hmm. And she's the youngest of them all. So they're like, how dare you defy culture norms? And, you got to go back. So she was like, okay, I can't let this impact my kids. I'm going to figure this out. So still, now I'm 14, nothing's working. So she goes to her brother, who's a primary care doctor. She's like, I don't know what to do. No one can figure it out. Everyone says it's going to come and nothing's happening. So him and his wife had gone through fertility treatment. So he said, why don't you see a reproductive endocrinologist? She can help you figure out what's going on.
Then you're 13 at this point.
Now I'm 14. So
okay.
Nothing's happened. So now I'm 14. So she takes me to a fertility doctor, and I have no clue what's going on. I didn't even know she just takes me, doesn't talk to me about it. And then so it takes me to this doctor. And I remember sitting in this waiting room, and it was just full of emotion. It was women who were crying. It was women who were happy. And this was now in the 90s. So there was pregnant women there as well. And I didn't know where I was or what was happening. So they call me back, and I go back with my mom. And I'm looking around. And if you've ever been a patient in the 90s or 80s, doctors' offices actually had posters, educational posters. So I'm looking around. I was like, oh my God, this is everything we don't talk about. There's a penis hanging on the wall. A pregnant baby coming out of a vagina. There's all sorts of, I remember I was like,
quite graphic.
Yes. Yeah, it was very graphic. I was like, where am I? And what am I doing here? We don't talk about this stuff. And this little Indian lady walks in, and she introduces herself and says, I'm Dr. Jabamoni. And literally my first question, because I'm completely freaking out, what am I doing here? And what is she going to do to me? And I said, what do you do? I literally remember that was my first question. I'm like, what do you do?
Good for you, by the way, for saying anything, for not just being quiet and letting it happen. I mean, that's a big deal at 14-year-old girl to just, that's very intimidating in that scenario to say anything. So
yeah. And well, she was so kind. And she said, oh, honey, I make babies. And that was a game changer, because literally, I was like, wait, I thought God made babies. You can make a baby. I remember I literally said that. I was like, what do you mean you make a baby? And she goes, I make it in the lab. We put the cells together. I take the egg and I take the sperm and we grow it. And I was like, oh my God, I want to do that. And I was like, you get to like be such an important part of someone's life. Like, I don't care what it takes and I don't care what it's going to mean, but I want to be you. And I remember I told her, yeah, I was like, forget what I have, but I want to be you. I don't know what's wrong with me. But so she diagnosed me eventually through workup with PCOS, warned me that I'm going to need fertility treatment in the future. I wasn't even thinking about that because all at that point I wanted to do was, how do I become you? So,
well, you were also 14 years old. My guess is you weren't thinking about PCOS and how's it mean when I'm older and going to get married and have babies. But
yeah, completely like didn't faze me. I was like, sure. But every year I'd go back and I would tell her like, okay, now what do I do? Now what do I do? And we eventually lost touch when I was 18, 19. I continued to go down the path of wanting to go to med school. I did get very sidetracked and I started modeling very purely coincidentally. I ended up winning a pageant, Miss India, got a modeling contract. And then I was at a big state school. I was at UIC in college at that time. And the first thing I remember my counselor said was, honey, you can't go to med school with these grades. And I was like, what does that mean? I'm like, of course I can go to med school. I'm going to be a doctor. She thought I was crazy. And I switched schools, went to a really small, then went off to a really small Catholic school that was very predominantly pre-med, nursing, like all medicine oriented. So I was like, I need to get out. I need to get focused. Ended up going to med school. I found a mentor, Dr. Turkaspa. He was actually one of the first doctors he had moved here from Israel. Dr. Valinsky, who was the first doctor who came up with PGT. So he started doing genetic testing on these 2-cell embryos. So he brought Turkaspa over to help him be the clinician, and he was the scientist. And I would read their papers, and I was so fascinated by this. And I was 19, 20. And I cold called his office and I said, do you need a student? And he's like, sure, I can use a student. And I remember I started shadowing him. So during my summer breaks and during my like evenings, afternoons after school, I would go to his office and everything was a paper chart. I would sit there, read through his charts and just help him do all sorts of research. And that kind of fueled my fire into wanting to go into truly continue to pursue this despite all my grades and everything that was against me. So having his research.
Did you have really bad grades or did you have like 1B?
No. So, with med school, so I retook everything. My first year is when I won the modeling contract. And then I was flying to LA, flying to New York. I modeled for Ralph Lauren. Like I was constantly doing shows. And at UIC, you need like a lab grade, you need a classroom grade, and then you need your testing grade. So even if my testing grade was great, lack of my presence in the other two brought it down. So I retook everything because those were straight C's. And then everything averaged out. And then so even if you repeat it, when you apply for your med school through the application process, they average your first grade and then your second grade. They basically said at that time that either you're going to have to get a second degree, like a master's degree to offset this GPA, or you could do a doctor of osteopathic medicine, a DO, or you could go offshore. At that point, there was no DO REIs. REI is a reproductive endocrinology and fertility is a very competitive fellowship. There's about roughly 37 to 40 spots a year.
Wow.
Out of those, only 2 of them go to a foreign medical grad. 1 to 2 go to a DO now, but at that time there was no DOs. And then the rest go to pretty much mostly Ivy League grads. So I'm sitting here saying, okay, well, how do I do this? How do I become a fertility doctor? And I'm not willing, I financially couldn't go and get a master's I just couldn't justify that cost. So I actually decided to go to London and I found this program through University College of London that would create this offshore program with American students where they would teach them and prep them for USMLEs. So you don't have to stay in that British system. after my first semester, I realized there's no way I could afford to live in London for 4 years. I was like, oh my God, this is like quadruple the price of living in the US. So I transferred out and I was like, it's not sustainable. They don't have a funding system. I couldn't afford to live here. So I moved back home for a semester, not even a month. And I was like, what do I do? So I called a Caribbean school and I said, I started med school in London. I don't want to repeat it. I'll repeat it if you make me, but you have to give me credit for it. Like you have to financially give me credit for it. And they said, fine, we can agree to that. So I went to Ross University, and that was truly where I learned how to study because it was an offshore school. There's nothing vacationing about it. You're in the Caribbean, you have zero food, there's lack of resources, and it's essentially like living in a third world country. Like they would run out of electricity and you would have to go fill your electricity card and then put it back in. And so it was very different. So the lifestyle was different. Adapting to it was hard. And you didn't really know anybody there. You were truly living on an island trying to become this doctor. So I would say, I remember just thinking one day, like, oh my God, I want this so bad. Make this fly by. Like, I don't know how I can live here for 2 years, but I was like, please just like make this go away in make it feel like a minute. And it was really hard, but it flew by.
And you were what, 20 years old at this point?
I was 20 years old.
Yeah.
2021. I continued working with Dr. Tracaspa. During any of my breaks, we would email back and forth. I would continue to do research. And I just kind of fostered my love for this field. And I became even more determined and passionate about wanting to just pay it forward. And it's such a new field and such a young field. And just in those 3 years, they went from growing an embryo only to 3 days to 5 days. And then they went from just 5 days to freezing. And just in that short 5 years, they went from pregnancy rates 10, 15% to 60 to 70%. So it was just fascinating. So that drive for it and love for research continued. I went to Wayne State because Mike Diamond, who's also a really big name in the field, who's ahead of the RMN network, or they don't have that anymore, but it was a publicly funded, essentially like it's a reproductive medicine network where they do cutting edge research, they create clinical trials, it's multi-site, they have big networks that they're a part of, and then they pool all the data to continue to change the field and evolve. And he was ahead of that. So I remember interviewing at Wayne State and sitting there thinking, this is it. This is where I'm going to match, and this is where I'm going to continue to grow. I ended up matching there. And then I stayed back to try to do my MD PhD. And I ended up getting a grant. It's called the Warher Women's Reproductive Health Research Grant. And it was K-12 through the NIH. And the reason I did Oncofertility, or my research was in Oncofertility, is because in 2004, as I was graduating college and getting ready to start medical school, my aunt went in with shortness of breath. And when she went in with shortness of breath, everyone automatically assumed you're Indian, it's TB, you have water in your lungs. And she hasn't gone to India since we migrated here in the 70s. And she's like, my family goes back, but I don't go back. And they're like, oh, you can still get it if it's latent and you're probably presenting with it. So they admitted her and they did a pluricentesis. And when they got pathology back, it actually wasn't TB and it was ovarian cancer.
How old was she?
She was 43, 44. Yeah. And they're like, oh, well, you have stage 4 ovarian cancer and you're going to die. So they're like, no one makes it past this. It's 6 months and it's all over your body. She had like a mental caking. It was in her liver. It was in her bilateral lungs. And believe it or not, knock on wood, she's still alive. And
that's unbelievable. That's truly unbelievable.
Yeah, it was.
And it was in her lungs?
It was in
her lungs and her liver, or just her liver?
Lungs, her liver. She had it's called Meg's triad. So it went up from her ovaries to her stomach, to her liver, to her right lung. And then that's how she presented with shortness of breath because it was bilaterally.
Yes. Oh my God.
Yeah. And so she ended up, they did chemo. Well, first they did chemo and then they did radiation and then they did this big debulking surgery. And they literally said, you guys have 6 months with her. She's probably never going to leave this hospital. And she was completely fine. So it was like, oh wow, how rare. But I didn't, I didn't think much of it. And then that same,
I'm going to be blown away by this piece of your story the whole time with your aunt beating stage 4 ovarian cancer. That's insane. That's
isn't crazy.
amazing. Yes,
Yeah.
she must have been an incredible woman.
She
She is an incredible woman. I mean,
yeah.
this is crazy. But yes, please continue.
So my mom's one of 5 sisters. It's 5 sisters and 5 brothers. And at that time we tested negative for everything. They're like, no, this is not genetic. No one has it in your family. And then that same when I was now in OB-GYN residency, got diagnosed with breast cancer.
Yeah, that's typical.
Yeah. And they're like, oh, this is because you're radiation. Like radiation can, and like, that's absolutely not radiation. So now this is 2011. I'm like, that's not true. Like you can get lymphoma, you can get, like white blood cell cancer, but typically you don't get breast cancer. So I'm like, we should repeat genetic testing. Mm-hmm. And she actually came back positive for the ATM gene mutation. Mm-hmm. So that's why I'm like, this is so crazy because had she followed her prognosis, and if at current day, like this is when people are reproducing right in their late 30s, early 40s, that's my patient demographic. They would have told her, you're done. Like you're end of life at 6 months, you're not going to live. And then she would have gotten another cancer. No one would have pursued it further because they would have been like, you screened negative. And thankfully, her kids kind of pushed and said, you have to screen. Like, this is so rare. What's going on? So we tested positive. And my mom, knock on wood also again, she's the only sister who hasn't had anything. But all of my aunts now have had breast cancer, thankfully, which is really responsive to chemo because it is a genetic form. But at that time, that's when I was going through, stayed back at Wayne State and said, you know what, there has to be more resources. Our fields are so disconnected. There's this oncology arm that a patient may never, they're thinking of their cancer. How do I solve this without thinking about, well, what happens after I solve this? How do I continue my childbearing? Or how do I just feel okay? Like, how do I imagine like hitting menopause when you're 42, not even being mindful of what that means for the rest of your life, your quality of life. So that's where that passion of doing fertility preservation, oncofertility, understanding the true impact of chemotherapy on reproductive function came, because no one really knows. No one knows what happens to your genetics, can you have a baby after? But that was also very short-lived.
That's incredible. So a couple sidebar questions. Yeah. Have any of your aunts, or I guess you for that matter, have they thought about, or did they ever think about doing any preventive measures like hysterectomies, fallopian tube removal, breast removal, like any of those things? Or is that way too sort of out there?
No, they have definitely. My aunt had a double mastectomy after she had recurrence twice after her breast cancer diagnosis. So she's had a double mastectomy. 2 of my aunts have done a hysterectomy with their tubes. My mom's the only one who has had multiple breast biopsies, but for some reason refuses. She's really scared of anesthesia. Apparently Kanye West's mom's tragedy really scared her. She goes, I'm not going to wake up. I'm like, Mom, that was so different. That's plastic surgery. This is a medical necessity.
But everyone has something. I mean, that's not unusual. That's not unusual.
Yeah. So I think it's so hard, such a hard concept to grasp because I'm trying to get her to do even genetic testing, but she doesn't want to do it. She goes, no, it's not in my family. I'm like, it is in your family. That's your sister. And the incidence is 50%. So,
how old's your mom now?
She's about to be 60.
Okay. She's so young. She's young.
Yeah. She got arranged married when she was 16 and had me when she was 18.
Wow. Okay. Yeah. That's a whole nother podcast.
Yeah.
Seriously. Okay. So moving on, it totally, obviously completely makes sense why, I mean, your life story is incredible. It's like, it's a movie. It's a young girl being dragged to the doctor and then being inspired and sticking to your guns and sticking with your dream. I mean, and all of this sort of zigzagging to get there across the world, literally. I mean, it's truly phenomenal. It's phenomenal. And then now being so obviously so successful and so, the top of your game, it's just like I mean, really a documentary. It's pretty amazing.
Thank you. I'm lucky enough to do what I love.
And then this piece that you brought in at the end, why you have this particular specialty. And I guess I don't even know if I call it a specialty. It was, motivation, drive to learn more about oncology and fertility and how they go together, and chemo and radiation. And the world I live in I'm always talking about cancer. And women are asking me all the time. And my answer, first and foremost, is I'm not a doctor. Please speak to your doctor. But what do I do? Especially for women who have cancer young, who have been through horrible surgeries, chemo, radiation, et cetera, and haven't had kids yet, or haven't saved their eggs, frozen their eggs, like all these questions. And I do think certainly there are a lot more answers today than there were 5, 10, 15, 20 years ago, of course, but there's still so much unknown. And there's so many women who don't have access to those answers that we have now. So I think that that's an incredibly important piece of your work, obviously from personal experience, but not from my own personal experience talking to some of these women, but then also just for filling these gaps, right? There's just these gaps in medicine and information. And like you said, there's I'm sure not very many people who are diving into this piece, right?
No. And it's because it's so hard to connect, and it's you can't, when you look at the limitations, like you can't study pregnant women. You can't study women with cancer who are trying to freeze their eggs, right? Because that's all they have, that 2-shot, those 2 weeks. Everything's animal data and driven, and it's harder to extract. Like all of my studies are done on a mice model. I can't say like, oh, it's, like the same dose of cyclophosphamide that impacts the mouse is going to impact you. So it's so vague and kind of hard to quantify and study. And that was the frustrating part. And I'm like, how do I get this tissue? How do I study this? And how do I actually make something meaningful of it?
So of the patients that you've seen and you see, have you worked in your practice with patients who have been through cancer, chemo, radiation? And tell me about that experience with maybe just a few of the positives, or if there's been negative sort of outcomes.
Yeah. I always try to find my limitations and then say, okay, well, if these are my limitations, how do I work ahead of them? Or how do I get behind that? And one of my limitations was after chemo and radiation exposure, it's so hard for me to figure out how to counsel these patients and if they're going to get their fertility back or not. So then I thought, well, if I'm going out and practicing medicine, why am I even waiting for them to come to me after chemo, right? Like there's clearly a disconnect between this oncology surgery aspect and them getting to me, because they get to me after they're done and then they survive. I'm like, why don't I intervene and try to set up a collaboration with the hematologist, oncologist, with the breast surgeon, or even radiology right when they get this diagnosis? So I created guidelines between trying to connect the two fields, and then I've been presenting it at grand rounds at big hospital institutions because they do tumor boards. So I've been trying to go to every local hospital, every academic center, and present at this tumor board. Like, hey guys, when you're talking to somebody who's newly diagnosed with cancer and they're in the reproductive age group, here's my cards, or here's the fertility clinic near you that you should intervene with. And then setting up process on the back end with the fertility clinic. Like you need to have same day appointments available for these patients. You need to get them in for random testing. You need to offer a fertility preservation discount, because the last thing they want to think about, they think fertility and they think money, right? Like all of those resources should be for their cancer. So if there's one thing we could do is put some good in the world, like either do it at no cost or do it at, break even. So implementing processes like that has really helped kind of stay ahead or get ahead of the game. It's still very intimidating though. When I see about 1 to 2 cancer patients a month, and you could see that they're trying to process, oh my God, what's going to happen after? And then process, oh my God, I have cancer.
What's happening right now versus how do I even think about the future? But if I don't think about the future, kind of how will I get through right now?
Yeah.
Right?
Yeah. Yeah. So the best thing I've always told them, and I try to do, is it's more like a concierge medicine. You have to change your fertility practice into a concierge practice to say, okay, I'm going to offload a lot of information on you, and it's going to go very fast because we only have 2 weeks, and it's going to happen like tandemly as you're getting your report, as you're getting your diagnostic testing, as you're meeting with your entire team. I'm going to be doing this in the back end. Like, you leave the thinking to me, but this is what's going to happen. So trying to like offset it by taking really like that mental, that financial, the medication burden off of them, trying to find programs and resources and educating your nursing team, your clinical team about it, so then they can well support that patient as well.
And explain to us why the 2 weeks. What are those 2 weeks? What's that window?
So a typical egg freezing or IVF cycle is 2 weeks. When you bring the patient and you do what's called a random baseline. So this no longer is based on your period. It's not like a traditional fertility workup and testing. It is, you come in, we count the number of eggs, we start a dosing protocol, and you start that night. An average stimulation for any egg freezing or IVF cycle is about 10 to 12 days, plus or minus 2 days. So that's my first question for any oncologist who will call me for a referral. Do I have 2 weeks? And the minute they say yes, and I'm like, okay, send me your clearances, send me your restrictions, give me your pathology. And then I also want to keep them safe. So if it's a ER receptor positive, then I try to stim them with estrogen receptor blocker. Not that, once again, very limited studies, but anything I could do to help.
It throws me back to, I was talking the other day, someone was asking me, when my mom had cancer, was she involved in sort of the world of cancer? Or was she a fundraiser? That was a question someone asked me. And this was back in the 90s. And I answered her that while my mom was battling ovarian cancer for 5 years, she was, 48 when she was diagnosed, she really didn't really want to have anything to do with it. She was just like, blinders on, I'm going to live my life, and I'm going to let whatever needs to happen, I need to do, I'm going to do, but I don't want to like be an advocate. I don't want to like stand on a box and talk about it. I don't want to be that person. I just think she couldn't. She had to compartmentalize it. But towards the end of her life, about 2 years before she passed away, she did do this big fundraiser, and she was really in the thick of it, but she looked spectacularly beautiful, and it was a really wonderful evening. But her motivation for doing it and being that person was really because she understood how disconnected the medical field was. It jarred her so much. And she felt like, I think my mom was the least selfish person I know. She was so selfless. So I don't know if it went through her head. I kind of hope it did. Like, how would her thinking, how would my diagnosis and my prognosis and life have changed if the medical fields were not so disconnected? And her understanding that research institutions were so far disconnected from the clinicians often, and the funding and all of it. And at a very base level, that was her understanding of the situation, understanding of this world, and then her motivation for saying, I'm going to do whatever I need to do to be helpful to her particular doctor, to be able to create some sort of holistic approach to just only, her ovarian cancer treatment. And I think that must have been the moment where I knew this is what I was going to do, and be able to find some collaborative approach and truly holistic approach. That's like an overused word nowadays, but where you're bringing different teams together who talk and share and collaborate. And it's always baffled me how in the medical community, that's often really not how it works. And maybe it's because people are so so honed in and focused on what they're doing and doing their job to the best of their abilities and finding the best outcomes, that they don't have the space to bring in other people to do other things either at the same time or collaborate in that way. I don't know what it is, but the fact that you're doing this, and seem to be, if I get this right, you're doing it kind of behind the scenes in this like beautifully articulate, soft way, but also quite forcefully at the same time, saying, give me my 2 weeks, basically. Give me my 2 weeks with this woman. I think is, to me, of all the things that you do, like that's kind of the most incredible, because I understand how difficult that is. Do you know that? Like, are you aware of how hard that is?
I got a lot of pushback when I first started doing it. I got a lot of angry doctors, and doctors are very stubborn.
Yeah.
And had a lot of pushback. Like, why is this important? Doesn't matter right now.
Right.
But it does matter, right?
Yeah.
Like, she's going to have a life after, and it's going to matter.
Yeah.
And it's 2 weeks that you're not going to start her anyways. Like, no one starts chemo the next day. You're still doing
No.
imaging. You're going to do your PET scans. You're going to,
Correct.
like, I lived it. I've seen my family members live it. So why not give that to me? And I've had to show them data. Like, I'm not increasing the risk of cancer. I'm not causing metastasis. Even when they have an ERP positive, data shows that it's not going to spread. I've even gotten doctors to say, well, literally in the middle, like, it's not covered anyways. Why would she do that? They can't afford it. I'm like, well, that's not your decision.
That's
like,
not your business.
no.
What are you to decide?
Yeah.
What she's going to pay for.
Right. And I've actually had to present fertility mandates. So when Illinois I helped the coalition. There's a coalition that does fertility preservation mandates from state to state through Resolve. And Illinois was the third state to become mandated for fertility preservation. And we had to go share the stories in Springfield of these cancer survivors. And when I did that, then it passed, and I presented in 2022. And I went around presenting it to these oncologists, and they're like, oh, it doesn't matter. And I was like, it does matter, because now it's covered. Now you don't, like, one of your excuses is gone. Like,
seriously.
Yeah.
I just threw your seventh excuse in the trash.
Yeah.
That is incredible. And I also think it goes back to what we were saying, which is for a woman in particular, fighting cancer and going through these treatments, which are so brutal. I mean, the treatments are worse than the cancer. And like, having to take that future option away from them, it takes away that, that a lot of, I think, my guess is for a lot of women, it would take away that like and that strength inside of them to get through it and to fight it and to bear down and fight through the horribleness of the chemo and the radiation and just the actual swallowing of the fact that you have the C word, to take away a light at the end of the tunnel. That mental impact is huge. And so I understand why doctors, surgeons, oncologists don't think about that. That's not what they're looking at through the windshield. Good for you for stepping up and like waving your hand in front of their face saying, oh, this is a really important piece of the puzzle for that patient for sure.
Yeah. And younger males, that's the most difficult. I do a lot of young males also. And I always applaud these parents are the ones that reach out with testicular cancer of young males in hospitals. And it's amazing. These moms thinking about like, okay, what happens when my son recovers and how am I going to have grandkids? And it's just, I'm glad someone, and we're starting to think about it, and it's becoming more and more non-experimental. Oh, that's what I had someone else say. Isn't this experimental? These don't survive and become a baby anyways. And I was like, yes, they do. That was like
look around.
Yeah.
Look at your preschool class. Yeah.
Yeah.
Seriously. So talk to me a little bit about how we think about fertility and the way you think about fertility when people are also now talking about longevity and this sort of field of longevity that's gotten so much hype recently. Longevity doesn't necessarily mean what a lot of people think it means. I mean, will you just dive into that a little bit and give us your thoughts on that?
Yeah. So I also had my own fertility journey with PCOS. So at that point, when she's like, you're going to pop a pill and you're going to get pregnant, although I wasn't thinking about it at that time, that's what I really was like, oh, it's going to be so easy. And truly no one in my family had infertility. I mean, my grandma had 12 kids. 2 of them passed away at birth and 10 that were living. All of my aunts and uncles have 3 to 4 kids. I have hundreds of cousins everywhere. So I wasn't even processing or thought that I would be impacted to the degree I was impacted. We got married at 27, 28. We started trying right away.
Which is really old in your family.
Yeah, so old. Yeah. I swear my mom was going crazy because my younger sister was already married. But I was determined. I was like, I don't care if I'm not married, but I'm going to be this doctor. I'm going to grad.
Yeah.
Like, I had a plan. So when I started trying, I was like, okay, I'm just going to give myself letrozole. I was an OB-GYN resident. So I was like, I'll give myself letrozole and it's going to work. Tried that for a couple months, didn't work. So I'm like, okay, I'm going to switch to Clomid. Tried that, didn't work. And I kept I did it so much without being monitored, without properly being diagnosed, that I started having adverse side effects. I started getting cysts and lining, and don't medicate yourself. So it was really bad. Ended up seeing a fertility doctor and just was dismissed. My first doctor told me, I'm not PCOS, I'm actually anorexic, like back to middle school again. And I was like, that's not true. Like, I've been tracking, I've been doing this at home and it's actually working. It was a really tough journey because I didn't end up having my son till I was 32. And when I had him, I remember thinking, okay, my husband's really into health and fitness and just healthy living. And I was the exact opposite because I was genetically blessed to be innately thin. So I was never really mindful of what I would eat. I was never really mindful of what I would put in my body.
Well, you were
And
eating Burger King for
I was
breakfast
eating
in middle
Burger
school.
King
Yeah.
for breakfast. And that continued. I remember like in residency, they would tease me like, oh my God, you have sugar with the side of coffee. And I was like, yeah, there'd be like half a cup of whipped cream, half a cup of caramel in there. And so for the first time ever, I got so exhausted. I was like, I'm going to try maybe living like you. So I started going to the gym with him. I just needed something to decompress. And that was the first time I actually got pregnant and stayed pregnant without miscarrying. And it was with my son.
And that was with fertility treatment?
With fertility treatment, yeah.
Did you change your eating habits as well?
I did. I started doing more fruits, more vegetables. I started doing more meats, not eliminated my rice. And I continued that while I was breastfeeding. And then I conceived again and I had my daughter spontaneously. Didn't even know I was pregnant. So then, it still didn't click at that time that, hey, there's some connection with my infertility and your quality of life or the way you live life. And then I started trying again for my daughter, my third daughter. We started at 35 and I didn't have her till 40. It took me another 5 years, just like it took me another 5 years with my son. And this time here I was thinking, okay, well, I work out now. And I didn't adjust my diet. And I thought working out was it, right? Like I live healthy because I work out. But I ended up seeing this reproductive immunologist who started talking about systemic inflammation and root cause of your any pathophysiology like heart disease, diabetes, high blood pressure, and all of that in my mind. I was like, oh my God, that's all in my family, right? It was like, check, check, check. Like I carry all of that. And that was my first exposure to this longevity medication, low dose naltrexone. Then I was put on metformin and I had my daughter. Like that was the embryo that I implanted. I didn't miscarry and I felt better than I've ever felt in my life. Like my back pain went away. I was getting better REM sleep. So I was like, there's something to this. There's something to treating your body as a whole to make your outcomes better in fertility.
Mm-hmm.
And my niche used to be PCOS and Oncofertility. And then all of a sudden, I saw my patient demographic switching because I was doing all of this anti-inflammatory and I started seeing all this endometriosis, all of this diminished ovarian reserve, all these patients who have this systemic inflammation that's causing them to have low egg count, low egg quality, miscarry normal embryos because something internally is going on and it's never being addressed or treated. So that's how I started getting into longevity. I started adding in peptides to patients when their mitochondrial function's down. I started adding in NAD and glutathione for both male and females because I'm like, okay, your embryos are stopping on day 3. That's sperm. Like, let's talk about your husband. Let's talk about his lifestyle. Let's talk about vaping, smoking, drinking. Like how do you live healthy? And that's what I was telling and Beth, like the longevity is not just living long, but it's how do you live better life, right? Like how do you live a healthier life? And although it's easy to mask high blood pressure with a pill or to take metformin for your diabetes, but what's causing it? Like, why do you have that and how do you manage it better? And I think that's what truly how I marry my fertility patients, my own fertility journey to longevity. And continuing that, I promise, like my husband always teases and it's like, you look even better than when I met you and we met at 20. And it's just living a healthier life for me.
You can only control so much, right? Genetics plays a big role, as you and your family have learned. And things happen. Like, there's no ovarian cancer in our family and pretty much no breast cancer that we know of. And my mom was diagnosed with ovarian cancer at 48. She was like you, similarly tiny and very thin. and she had a horrible diet. And do I think that was part of it? I have no idea. But I think like there's only so much we can control, but what we can control has a huge impact on our entire system, head to toe. And I think that the way you're looking at it, it's sometimes almost impossible to do until you go through your own journey, and you really see it and you see the effects. And I also have heard, when I talk about longevity, and I've just started to sort of bring this into the conversation, a lot of people say, well, does that mean I'm trying to live to 120? And my answer is not really. I think longevity is more about quality of life. And then also quality of like death, like quality of life and how do you live those later years leading up to your death? We're human, we'll all die at some point. But how is that going to happen? And is it going to be really ugly and horrible? As I'm sure many of us, I know I have experience with grandparents, even parents, or is it going to be a little bit more graceful and a little bit more out, easy on the eyes and easy on the heart and the soul for all of us? And I think to me, that's I don't know if the joy is the right word, but that's like the peak of this newer topic of longevity and what we can learn about our body and truly like how everything that comes in and on our body, everything has every effect has an opposite and equal reaction, right?
Yeah.
Every action has an opposite and equal reaction. I think so. Figuring out how to take what we can control. And it's funny, almost every doctor I know leads the most unhealthy lifestyle, which is interesting. But I think sometimes until they go through their own personal journey. But I do think that how incredible that you were able to not just like switch up your dietary habits, but look at it from the really like the whole body perspective and the whole sort of holistic perspective. And then bring that into your practice is pretty cool.
Yeah. Somebody asked me on another podcast 2 days ago, and they said, why did you do that? And I know you see it all over. It's highly criticized because it's new, it's untested, it's unproven. So not a lot of fertility doctors believe in what I do. And there's very handful of them. So I see patients from all over. And I couldn't help but literally say, when I was going through this, I probably went to every single doctor and clinic in Michigan. And it's not that I didn't think that I couldn't find a donor egg. I'm Indian. Like donor egg 12 years ago was impossible to find, especially an Indian one. And when it wasn't making embryos, when I made embryos, I couldn't hold my embryos. And truly, not that I thought there was anything wrong with that. And I think it's a beautiful journey and process. But I wanted to know that somebody has exhausted all of their options for me before suggesting that. And I want to know, like, you did not leave a single stone unturned before you presented that to me. And that's why I do it, because before I tell you, hey, let's move on to the next, I want to know that, I looked at everything. I treated you as a whole. I addressed everything I can possibly do. And I know it's like supplements. Sure, it may not work. You'll pee them out, but I would rather try them than not try them, or at least be presented to have the autonomy to make that decision for me.
There's a nutritionist, Alyssa Goodman, who I've interviewed many times, who's a good friend of mine, and she had cancer when she was younger. And when she finally found a doctor that worked for her, the first question he asked her was like, how are you? What's the stress in your life? Like, how's your life? And that, she said, was just a turning point. It was like, no, changing my lifestyle, changing my job, my career, my location where I live, and just the way I lived my every single moment of my day didn't cure me of cancer, but it sure helped. And so, and just even I think being asked the question changed her entire mindset, which I believe changed her ability to fight what was going on inside of her. And so I agree. I think that sometimes that's the first question, right? Like, before we get into everything I can prescribe for you, like, let's talk about what are you doing? Like, what's your day? What do you eat? What do you drink? How many hours a night do you sleep? The idea that stuff doesn't have some effect to some people more than others would seem crazy.
Yeah.
But I don't think that many doctors ask those questions or really even care about asking those questions or about the answer. It's, it has to be purely scientific and purely medical. But that is also scientific and, in its way. And and I believe there's a marriage of the two, which obviously you're doing, that makes it so beautiful. And that's when the magic happens, which you're clearly making happen all over the place. So if there's something that you can think about that, either you do or research falls in your lap or you stumble upon or you work, you collaborate, like what's the next step in what you're thinking and what you want to do? Or maybe maybe there isn't.
There definitely is. I know I've been able to successfully marry the practice of longevity to my fertility practice, but I would love to I get messages all day long. Like, I wish you lived closer. I wish I had the resources to come to you. I wish my doctor did this. I would love to educate and empower other doctors to say, just try it. And if not for anything, just like you said, for hope, right? Like, it may not change anything, but having that hope to know that, oh my God, there's something else for me to do is just a game changer. I know it was for me in my journey. Like, there was times where felt like I was at the very bottom, like, this is it, I'm done. But that one inkling of hope kept me going. And I mean, that's how I have my 3 beautiful kids.
It's amazing. When I think of hope, I just think of like a twinkle in the top, like when you close your eyes, you see that twinkle. It's so powerful. It's so powerful to get you through bad times. It's so powerful to get you through good times. I think that's such a piece of humanity and a piece of who we are. And especially as women, like I think if you lose that or you don't have that firmly embedded in you, it's a different life. It's just a different life. So yeah, I think that's an incredible goal. I think there's always 2 sides. It's talking to patients and lay people, and then 50%, if not more, it's educating the medical community and giving especially those stubborn doctors you referred to earlier, giving them the opportunity to understand that there's other things. There's might be more pieces to the puzzle than they're just looking at. Which is that's a tough job.
That is a tough job. But, one patient at a time, when I prove it, I think results speak for themselves. I have random doctors asking me, like, how do you use this peptide? I'm like, well, let me show you.
And that must feel amazing. That's awesome. Thank you so much. This was wonderful. I could literally talk to you all day, but like I said at the beginning, I'm trying to be mindful of your time. You have patients to get back to. And thank you. This was just phenomenal. And the work you do is, you help bring life into the world. I don't really know of anything more beautiful than that. So thank you for all that you do for those in your community. And I think in the future for those you will teach out, in the bigger communities. Thank you.
Thank you for having me.